Hi, my name is Georgia, and this video is going to talk about stillbirth and fetal loss after 20 weeks of pregnancy. If you're here watching this video, you or someone you love and care for may have experienced stillbirth. Firstly, I'm so sorry you're experiencing this. Secondly, I hope this video brings you some reassurance and support to you and your loved ones. While all efforts have been made to explain the medical terms in this video, please do not hesitate to ask your midwife or doctor if something does not make sense. This is a sensitive topic, so if anything mentioned here today affects you, please know that there are supports available, some of which are listed here on the screen: Red Nose, Lifeline, and Beyond Blue. What is stillbirth? Stillbirth, or fetal loss greater than 20 weeks gestation or 20 weeks of pregnancy, is known as stillbirth. It also includes babies born over 400 grams where the gestation is not known. Fetal loss over 20 weeks is often unexpected and the exact cause is often unknown. There are investigations which can be done to explore the causes, which will be explained later in the video. As mentioned before, while in many cases the cause is unknown, a few are listed behind me, and we'll go through these more detail on each slide. Preterm birth before viability, which refers to the gestational age of a baby less than 22 to 24 weeks, depending on the health service, or smaller than 400 grams, where resuscitation would not be possible, is one cause of fetal loss. Placental insufficiency is another potential cause of fetal loss. Placental insufficiency can be explained as the placenta being unable to deliver enough oxygen and nutrients and blood to the fetus inside the uterus. This can lead to fetal growth restriction, fetal distress, and heart rate complications, leading to fetal death in the uterus. There are several reasons that the placenta may not work as well, including incorrect implantation in the early stages of pregnancy, maternal health conditions such as preeclampsia and diabetes, reduced blood flow through the placenta due to infarcts, clots, or calcification along or within the placenta. Infections can be another cause of fetal loss after 20 weeks. There are 3 different ways that an infection can cause stillbirth. One being placental dysfunction, where the infection can impact the way the placenta functions, leading to placental insufficiency, as mentioned earlier. Another is infection to the fetus. And thirdly, an inflammatory response within the mother's body in response to the infection. This can cause preterm labor, which can result in the fetal loss, as mentioned above. One way that this can be identified is through a blood test, which you may hear referred to as a torch screen. This stands for toxoplasmosis, rubella, cytomegalovirus, and herpes simplex virus, which are all infections that can harm a fetus during pregnancy. Another way that this can be identified is through testing of the placenta with your consent after delivery. Fetal growth restriction can be another cause of fetal loss after 20 weeks of pregnancy and refers to the slowing growth of a fetus which measures smaller than the estimated gestational age. This is commonly linked to placental insufficiency, as we discussed earlier. Umbilical cord accidents refer to complications with the umbilical cord inside the uterus, which may include knots in the cord, which we call true knots, the cord wrapped around the neck of the baby, cord compression from different fetal parts, and the fetus squeezing the umbilical cord, as well as a cord prolapse. A cord prolapse can occur after the membranes or the waters break and the umbilical cord falls down past the fetus into the vagina and restricts blood flow. The umbilical cord accidents are not preventable and are not related to any maternal actions. Oxygen and blood flow to the fetus are immediately cut off during a cord accident, which can lead to fetal loss. Maternal health conditions can be another cause for stillbirth. These conditions may be pre-pregnancy, diagnosed in pregnancy, or not yet diagnosed, all of which can be difficult to understand. Conditions such as high blood pressure or preeclampsia, diabetes, or blood clotting disorders, to name a few, can impact the function of the placenta and the growth and well-being of the fetus. It may impact how the placenta adheres to the uterine wall. For example, if you're diagnosed high risk for preeclampsia or with high blood pressure, you may be started on a medication to improve the growth of the arteries inside the placenta. Genetic abnormalities with the fetus are the leading cause of fetal loss in Australia. Genetic abnormalities can be chromosomal or structural, and some of which can be referred to as incompatible with life. This could include trisomy 13, 18, or Turner syndrome, or structural abnormalities with the brain and heart. This can often be detected on an ultrasound at around 20 weeks, however, some may be diagnosed after a stillbirth. Over the next little while, we will discuss some of the things you can expect to happen from now, including birthing your baby and postnatal cares. Please feel free to pause this video at any time if you need and check in with the team, a loved one, or any support services. A fetal loss after 20 weeks is often confirmed through an ultrasound where there are no fetal heartbeat seen or heard. There is often a doctor and a midwife with you at this time. The doctor will discuss what has happened and time for questions will be offered. Connections will be made with support services, including social work, and discussions will begin about delivering your baby. An induction of labour will be recommended if not already in labour to deliver your baby. A vaginal birth is recommended if safe and if the woman feels comfortable. Medications will be used to induce labour. This can vary depending on the hospital and the situation. However, the medication can be given through an IV cannula into the vein or a tablet into the mouth or the cheek or vaginally. All pain relief options are available, including nitrous oxide or gas and air, morphine, an epidural, water therapy. There will be time after your baby is born to hold them, take photos with them, and memory books are offered and made by the midwives. Midwives will be with you throughout this process to provide you support. Postnatal cares. The midwives will monitor for bleeding, signs of infection, and your emotional health post-birth, as well as help to suppress breast milk production if this is what you are wanting. Time is given to spend with your baby. Questions are always welcome. Support services and information will be given and explained, and they are also mentioned at the end of this video for reference. Social workers will come and see you and your family to offer their supports to assist with funeral or burial arrangements and next steps. Investigations. The placenta is often recommended to be sent for testing with consent with the aim to determine the potential cause if unknown. The medical team may also offer an autopsy on your baby to assist in determining a cause. This is something you'll be given time to decide and discuss, and the doctors will offer follow-up in 6 to 8 weeks after birth to debrief and go through the results. Understanding the cause of death can be helpful in the grieving process and can assist with possible future pregnancies. The needs of the woman and the family during this time are one of the most important steps in this process. It's a difficult time and often unexpected time in their lives. Emotional needs lay at the front of experiencing fetal loss after 20 weeks. It is during this time that the grief is normal and it should be welcomed. A safe space is held for the woman and her family to grieve the loss and make memories with their baby. During this time, photos are offered and taken. Heartfelt is an organisation across Australia which takes professional photos of people experiencing fetal loss after 20 weeks. This can be a wonderful opportunity to gather as a family and spend time together. A memory book is also created with hand and footprints where possible, as well as some photos. Spiritual needs are also important during this time. Religious traditions and cultural practices are welcomed. Clear communication during this time is crucial. Information should be provided in a way you're able to understand and in your first language. Translator services are available if needed and should be used to provide the best care. Fetal loss after 20 weeks gestation, there are ongoing health considerations that should be discussed. These include physical health, mental and emotional health, family and relationship support, future health and pregnancy considerations, and social supports. The recovery after a fetal loss at 20 weeks is similar to that of any birth. It's important to monitor signs for heavy bleeding and infections, follow up with midwives and GP services to manage postnatal care, which includes suppressing breast milk production if you're wanting to, support with the physical changes to the body from pregnancy and birth, as well as mental and emotional support. Screening for mental health occurs as normal with any pregnancy and birth. However, referrals will be made to provide mental health services and stillbirth support services, as well as support groups with your consent. It's important that during this time you check in with family, partners, and other children, as everyone will navigate grief differently. Services and supports are available and are discussed at the end of this video. While not brought up immediately, during this time there is also a need to consider future pregnancies. Following pregnancies, depending on the cause of fetal loss, if known, you may be offered extra ultrasounds to check on the growth and well-being of the baby, genetic counselling, emotional support and reassurance, as this may cause heightened emotions, and management from the medical team, again, depending on the cause of loss. It's crucial during this time that you take care of yourselves and each other. As mentioned before, support services are available for those who are or have experienced fetal loss after 20 weeks of pregnancy. There are many, however, few will be mentioned today. Red Nose and SANS are a joint organisation which provides support services for families who have experienced stillbirth and child loss, as well as offering assistance to cope with the grief, anxiety, and emotions that come with loss. They can be found by visiting rednose.org.au. Bears of Hope are another organisation who provide support groups and services as well as bears to families who experience stillbirth. They can be found through bearsofhope.org.au. Stillbirth Foundation Australia is an organisation nationwide in Australia who fund research, provide education and support to those touched by stillbirth. They can be found at stillbirthfoundation.org.au. Heartfelt, as mentioned earlier, is a not-for-profit photography service who can attend hospitals after the birth of your baby and take professional photos for you and your family. Australian Breastfeeding Association is a 24/7 phone line that can be contacted for support regarding breastfeeding and or suppressing lactation following delivery. Take care of yourself during this time. There is support available to you and your family as you need.